Everyone, let's practice for RRB 2024. This is a question set which is for RRB 2019 part 1 and set 1. So let's start the practice session. At first question is, which principles of management states that the employees should receive orders only from superior? The options are unity of command, comprehension, free rein direction and efficiency direction. The right answer is unity of command. The next question is process of identifying and implementing the best practices which leads to excellent performance is known as. That means identifying and implementing the best practices which leads to excellent performance. That means by which we are able to know that is the excellent performance. The options are Gantt charts, part chart, table marking and benchmarking. The right answer is benchmarking. Sometimes we call that after crossing the benchmark we will assume that this is the best performance. So the right answer is benchmarking. The next question is, a brief description of an observed behavior or incident is known as. A brief description of an observed behavior or incident is known as. The options are clinical record, family record, cumulative record and anecdotal record. The right answer is anecdotal record. The next question is, which type of communication is followed by video conferencing? The options are visual one-way, audio-visual one-way, audio-visual two-way and visual two-way. Video conferencing means there is two portion, video and audio, and two-way communication should be there. So the right answer is audio-visual two-way. The next question is, inadequate pumping action of the heart is known as. The options are anaphylactic shock, obstructive shock, cardiogenic shock and septic shock. Ineffective, inadequate pumping action related to heart. The right answer is cardiogenic shock. Next question, an abnormal accumulation of the fluid is known as. The options are edema, necrosis, epistaxis or inflammation. The right answer is edema. Edema means abnormal accumulation of the fluid. The next question, the removal of tissue from the pleural space is known as. From the pleural space, pleura means the membrane which is surrounded in lung. So the removal of tissue from the pleural space is known as. Options are lung biopsy, liver biopsy, spleen biopsy and pleural biopsy. The right answer is pleural biopsy. Next question, which one of the following is a second line drug for tuberculosis? The options are isoniazid, rifampicin, amikacin, ethambutol. Ethambutol, rifampicin, isoniazid and spironolactone are the first line drug, but amikacin is the second line drug. So the right answer is amikacin. The next question, which is an intervention for a patient with chronic obstructive pulmonary disease? Immediate intervention or effective intervention, which? There are four options like pursed-lipped breathing, high flow oxygen, chronic steroid therapy, high carbohydrate diet. The right answer is pursed-lip breathing. Pursed-lip breathing increases the capacity of lungs. So pursed-lipped breathing is very essential intervention for a patient with COPD. The next question is, the condition where a patient sees a rope and fears it to be snake is called. The options are illusion, delusion, hallucination, depersonalization. The right answer is illusion. In illusion, the person misinterprets a thing. Next question is, the method of helping the individual by encouraging him to discover the reason for his behavior is called. The options are cognitive therapy, individual psychotherapy, behavior therapy and crisis intervention. The right answer is individual psychotherapy. Next question, The process of altering the state of consciousness induced by conditioning and skilled use of suggestion is known as hypnosis, relaxation therapy, cognitive therapy, and aversion therapy. The right answer is hypnosis. The next question is, what is the other term for recovery from an illness? The options are remission, reaction formation, regression, rationalization. The right answer is remission. Next question, a percentile degenerative disease of the brain affecting the frontal lobe is called. The options are neologism, Oedipus complex, Pick's disease, orgasm. The right answer is Pick's disease. The next question is, universal safety precaution are a set guidelines to protect the patient, general public, patient's relatives, healthcare worker. The right answer is healthcare worker. Universal safety precaution is taken from the protection of healthcare worker.